My name is Anne Miek Vroom. I'm the founder of the E-helse Foundation and I'm a medical sociologist. And I will start with a poem. Love life when the storm wind growls and when spring comes. And don't hide when the rain falls and when the thunder hits. Sing the highest song, fly in a bird's eye through the blue sky. Love life and don't be afraid. I was born on a cold winter afternoon in 1981, surrounded by lots of love. At first my parents thought they were carrying a healthy baby. However, I cried 24 hours a day. For 2 years they went from hospital to GP, from clinic to pediatrician to ask why their child was so different from the older 3 children. I was always found healthy. Time would stop the holding, but nothing could be further from the truth. My parents again went to see a doctor. During a physical exam for possible hip dysplasia, a medical specialist broke my neck. A big shock for all involved. The x-rays showed that I already suffered all kinds of fractures in my young life, including rib fractures. Osteogenesis imperfecta, the so-called brittle bone disease, as the cause. And against all odds, I continued to live. Due to the rare nature of this condition, the doctors could not predict what my life would be like. What my parents did not know, but my parents did know, was that they would do everything they could to lead the best life possible together. Live like a child, from the wind and from the love. As you can see, I experienced a lot of medical events, like going in this retro ambulance to the hospital. This is a picture of me at one of my birthday parties, and you can see the creativity and the resilience. This is me. In this picture I can remember that my sister was yelling. After I broke my back, I was trying to walk again, and my sister, she told us, Mama, she can walk again, she can walk again. For my parents it was always very important that I could meet healthy others. So I could join my peers and go to regular schooling. And in that time it was very rare to go to a regular school. But it really helped me to be who I am at this very moment. The story is never ending, the medical story too. This is one of the x-rays of my spine, and as you can see I experienced a huge operation of my spine, and it gives me a lot of pain still to live with this kind of metal in me and all the wires and broken wires. When the rain falls or the thunder hits, sing the highest song, fly through the blue sky in a bird's eye. Love life and don't be afraid. But there were also very much wonderful experiences, like being part of the team of TEDx Nijmegen and being on stage. Or this one, I've been knighted by our queen. It was a very wonderful moment, and again my sister was there and she was very happy for me. Let me take you to the story of E-helse, my foundation. I've taken you on a small part of my life's journey. I have to fight for a good life and sometimes have to fight for good care. That's why I so much rather sit next to each other and extend a helping hand. I'm not a trade union woman by nature, and I was therefore looking for a way to use my experience and my knowledge to contribute constructively and equally to better care. Dance with the moon, wrap your arms around the stars, follow your dreams in the rhythm of the seasons. After 15 years of boarding at patient organizations and working as a scientific researcher and consultant in hospitals, I knew for sure in 2014, I'm going to turn my dream into an organization, E-helse. It is time to make much more use of the wealth of experience possessed by the end user, the patient. The patient knows exactly what the effect of illness is in her or his life. The patient is the expert. ICON wants to improve the quality of care. And we do this by an ecocentric perspective on quality of life. For us, it's very important to cooperate with all partners in health and healthcare. And we have chosen to work with the concept of quality of life, because it's all about the meaningful use of experiences, and experiences are part of your life. And I want to take you in the possibilities of participation of patients in healthcare at an organizational level. As you can see, we work with a very large group of clients, governmental organizations, companies, innovators, hospitals, long care institutions. And it's very interesting to be part of this giant system of all very enthusiastic people willing to improve healthcare. This is our group of patient experts. We work with a participatory organization model, and all these people are recruited at our organization, and they do have as well as patient experience as a professional quality, like somebody is a pharmacist or a nurse or a communication manager, and they all take part at our organization as a co-creator or as an advisor. At ICON, we developed a patient maturity model. And at the very left, you can see the century of patients passive. For my colleagues, for me, life would have been very passive like 70 years ago. This is about the 50s of the last century. At the time, most people with an illness or disability were living in the woods. And you were released from all your social obligations. You had to be sick. It was not normal to go to work. And also in people, the more average patients, they were also obliged to stop working, be ill, and judge your situation as undesirable. Talcott Parsons wrote about this situation too. He said this is also a situation that your illness became your social role. The human being was a passive recipient of care. But then we see the next stage, the stage of a patient more being more aware of our role. This is the situation of patients' consciousness. And for us, this is the time of the 70s of the last century. People were speaking up loud, and also people with a handicap were coming out of the woods and telling, I want to be part of life. And it's also very interesting that there were more facilities for being part of life and to work and to cooperate with your handicap or your illness. And then in 2000s, we see the era of patient centricity. And for us, it's still we put the patient at the center, not the patient is the center, but mostly when you read the documents, it's about putting the patient in the center. And it's a very positive thoughts, because it's also about shared decision making, about value-based healthcare, about cooperating, but still there's some inequality in how we cooperate with each other. And that's why we want to help organizations into the era of patients' equality. And equality is, in our opinion, really about cooperating together, asking patients to join at a organizational level to design healthcare together. So at the end, we will have a situation of the patient leading. And this is not about being the patient being the boss, or the patient telling you can do this and the nurse can do that and the doctor can do that. But this is the era of designing health really from a patient's focus and not from an organizational focus. This is the era of quality of life being the most important part. Not what can I offer as an organization, but what can we offer for your quality of life. As you can see, our maturity model shows really the changed patient role. And this is also being about a changed social role. When we work from the life journey of people, we need to experience more than only the emotional experiences or the medical challenges. Like, we worked together with a lady of 85 years old, and she was ice skating. She's from Friesland, a very northern province of the Netherlands, and she was telling about she had an open wound because of the ice skate. It went into her leg, and she needed care in the hospital for the wound. And every time when she came in the hospital, she asked, "Can you please wrap it up in this way? I can drive my car." And she continued asking every time she came in the hospital, "Can you please wrap it up so I can drive my car?" And then at a patient journey session, we asked her to redesign the wound care department, because perhaps some kind of care could be given at home. And then she said, of course, it would be very nice if some of this care could be given at home. But more important, nobody ever asked me why I didn't have anyone in my personal life to join me in the car, why I had to drive myself, and why I didn't have a neighbor or a family member to drive me. And I didn't dare to tell that my husband died in the week I got wounded. And I was very sad, and it would be great if there was more attention for my personal story. So then we've got to look to the total life journey. And then it's more about what is quality of life, what options does a person have, and what is needed in the social and physical context to connect with all this, what makes people resilient. And then it's really about listening to people, listening to their stories. And sometimes people tell me, well, it's quite hard for me to listen to those stories because I do not have any influence, and then I'm bothered by the stories, and I think it's not my role in this organization to change the total system. So it really makes me anxious to listen to these stories. And I was thinking about this. How can we work together with people and really change together? At Remembrance Day in the Netherlands, Arnon Grunberg, a Dutch writer, he gave me peace about this question I have. And he said, if listening to experiences, narratives, is also the desire for knowledge, then details are important. We've got to listen to the details, because knowledge consists of details. And then we cannot afford to say that we do not want to hear these details, because they disturb us in our sleep. Love life in the grey night and when the morning smiles. Love life and do not be afraid. Do not be afraid. And then we always tell people, you cannot create experience, you must undergo it. So we've got to listen to the patients. And that's very important. I wanted to tell you about a journey session. We were asked to help an organization because they started with a consulting agency. And the consultant agency conducted a session with all nurses. And the nurses were telling them that patients were asking at the emergency board, the patients were asking, sister, or nurse, can you give me some water? And they said, perhaps we can innovate something, a catering car, so we can help people getting the water more easy. And they were thinking about how to organize this. And then we had the session with the patients, and we asked the patients, the nurses, they were telling us it cost them a lot of time. And every time the patients asked, nurse, can I have a glass of water? And then the patients told us that they asked the nurses not because of the need of water, but because of the need of attention, because of all their anxiety, because all the rings of the equipment around them, and they bleep, bleep, bleep. They do not know what it's all about, and they want to be told what is going on. And when comes the doctor? When can I see the doctor? Is it taking more hours ahead? So there was a very different question. And when you do not co-create together with patients, you will be sent back and you've got to start all over. As you can see, these are the phases of transformations. And as I told you, when you ask the patient too late, you will be sent back to start. And the literature shows us you need 3 extra iterations. It gives you a lot of energy, it touches hearts, and you do want to cooperate patients when you innovate, because it's really wonderful for your workflow, and you will design together and you will keep the energy also in the implementation process of healthcare. So how do you do this? Well, you listen to the story, you listen to the life journeys. They are all wrapped up in the narratives of people, and these are the experiences. You, of course, can connect your own clients, your own patients, your own loved ones in this process, because they are the best storytellers. We always tell everybody can cooperate. It's not important to be highly intelligent. It's not important what kind of cultural background you have. It's important to be very diverse in attracting patients, because these are all the people working with you, and they are all your clients. So you've got to cooperate with them in the whole design process. And when you want to translate some things from the experience to your healthcare models or etc., then you can ask patient experts or people from a patient organization who are more experienced in translating the stories into the language managers or innovators know. So you can choose to start with the patient experts, and then start again, and then ask the patients, then get the stories, then again talk with the patient experts. So it's a dynamic process, and it gives you a lot of energy. We worked together with a hospital where we conducted these kind of exercise things. We worked with them for 3 years, and it was wonderful. This is an overview of the results, and they told us this is really the first virus a hospital is looking for. It gave us a lot of energy. It gave us a lot of pleasure. So this is why we want to help a lot of people to co-create with patients. We are building a do-it-yourself co-creation tool. At first it will be launched in the Netherlands, but after this we want to make it more possible for foreign people to make use of the tool also. And I hope we will get to Norway to help you co-create with patients. Most important, be prepared. Become skilled in how you can cooperate with patients, because you've got to arrange a safe environment in which people dare to be vulnerable, in where people, all kind of people, the nurses, the patients, the doctors, the managers, the innovators, your social workers, all people dare to cooperate with each other, where we know that there's a lot of equivalence, and where we are willing to start with a positive mindset and change healthcare the better together. Thank you very much. My name is Anne Miek Vroom. This are my socials. You can find me at Anne Miek Vroom on Twitter or icon_NL. And we would love to meet you in future to cooperate together. Thank you very much.